Okay, so my people come they tell me say, as you sit down today, make I ask you this one. Make them learn. I can ask them waiting me that one. They say nah, when they treat infection finish. If they come back, think say infection don't go. You know, go reach 1 week, 2 weeks. If the thing will start, they worry them again. They will come treat again. It will begin worry them again. Why they cause them to come again, come retreat? So make I ask you.
Okay, is obtainable. The error can come from two ways, either from the patient or from the drugs or from the prescription or from the physician. Any error can come from any angle. But 70% is coming from the side of the patient.
Okay.
This is a case of what we call therapeutic failure and recurrent infection.
Okay.
In this aspect, it's expected that when you go for a lab, a health check to know your sickness, to know what is the situation, you will be sent to a lab. But most often, the major causes of therapeutic failure is what we call tentative diagnosis or blind treatment. Blind treatment is treating a patient without a lab result, a laboratory finding, assuming from what the patient explained as the cause of the sickness, and then using it as a symptom to treating the symptomatic treatment of the patient. And in that aspect, we concentrate on this drug. When they use that drug, we find out that to some people, it might be lucky enough that those drugs are sensitive to the person, even though a laboratory finding was not conducted. But to some people, you are using the one that if they carry out the laboratory finding, it becomes the resistance one.
Okay.
So treatment should be on laboratory findings. Number two is wrong prescription.
Okay.
Some people, when they get to the lab, after doing the lab results, the lab scientists these days now prescribe drugs for them on a paper. And some of them will walk into the pharmacy and then give this. If there is an error and the pharmacist want to find out that this is this is this, they will tell that the lab scientist wrote it. Just give me as it was written. Forget the fact that you are supposed to revert back to the physician who sent you to the lab, and then the physician will be the one to tell you what and what, and then prescribe drug from the outcome of the lab. But the lab scientist will prescribe from the little knowledge of what he knows. The one is one-sided treatment. Now, this is one major one. One-sided treatment is in the sense that you have a partner, maybe your boyfriend or your girlfriend or husband and wife. They have one went to the lab and discovered that he has an infection. Treat it. Some may not even let their partner know. Some are treating it hidingly that they don't want their partner to know. Forgetting the number of times they may have intercourse together, have sex together. And then maybe the ones he has have already gone to the partner, or even the one he has was from the partner. Now, when you treat yourself one-sidedly, in the course of the treatment, you are still having sex, intercourse with your partner. What implies that as you go back, you still collect what you deposited. So the treatment, at that point you are taking drug, you will see results because the drug will not allow the incoming ones to manifest. But once the drug finish, the infection will begin to come out again because you have gone back to the cause and collected it again. Then number 4 is the non-compliance to medication. Okay. Most of the time you see patients, when the physician writes, take these drugs for 7 days, take these drugs for 10 days. Some people, after taking the drug for like 3-4 days, they won't be seeing the symptoms again. To them, why am I still taking drugs when what is a problem has gone? And what do? They dump the drugs. And that is a pure case of non-compliance. And once they dump the drug, they are not seeing the symptoms. Remember, before infection manifests in the body, there are certain levels it has to reach before it will manifest in the body. And how will it do? When they start taking drug, as far as the level of that infection, the severity goes down below that. Immediately it goes below that the manifestation, the person will start seeing symptoms. And to him or her, he has been healed. And then dumping the drug doesn't mean that the doctor don't know what to do. At the latter stage, you are supposed to take the drug even beyond the level where the doctor writes. Some days, 1 or 2 days beyond it, to ensure that any little trace remaining will be wiped out. And then after that, the last stage, you have to go back to the lab to do a second finding. That thing you find out before treatment, were the drugs or the medications able to eliminate them entirely. But some people, because once they don't have symptoms again, they won't go back. Nothing concerns them. Bye bye to the lab scientists. They can't go back to do another test. But within that 1 or 2 months, those little ones remaining left over will begin to multiply, will begin to increase in size. And then when they grow up to that level of manifestation again, the person will start seeing infection symptoms, maybe in 1 week or 2 weeks or 3 weeks or even 1 month. And they will say, the drugs they will give me did not work. No, they didn't completely eliminate the infection at that early stage.
It's okay. Thank you, sir. And I don't hear symptoms talking. Now make we bring on this platform. Look on they study, they learn how and I go take good care of on our health. Remember, say health, now be wet.